I'm Hank. I just turned 55 years old. I am a husband and father of three kids. A few months ago, I've been diagnosed with stage 3 pancreatic cancer. Due to my aggravating symptoms, I'm now hospitalized and treated by Dr. Tisdale. Lately, I've been experiencing a lot of weight loss, fatigue, loss of appetite, and muscle weakness. Luckily, Dr. Tisdale could explain the worsening of my symptoms very well. She introduced me to the term cancer cachexia.
You told me you suffered a lot from loss of appetite. This is very common in this disease, and I'm going to explain why. One of the potential factors that is increasingly investigated is the role of the adipokine lipocalin 2. Lipocalin 2 is a biomarker for kidney injury and has antibacterial and anti inflammatory properties. In addition, lipocalin 2 is thought to be a pathological mediator of appetite suppression during pancreatic cancer cachexia. A variety of inflammatory signals induce lipocalin 2 production, including lipopolysaccharides, interleukin 1b, TNF alpha, and interferon gamma. Upregulation of lipocalin 2 is mediated by multiple transcription factors, including NF-kappa B. Lipocalin 2 binds to its target organs through three receptors: the megalin receptor in the kidneys, the SLC22A17 receptor expressed in multiple tissues, and the melanocortin 4 receptor in the brain. During pancreatic cancer, the tumor cells produce a variety of pro inflammatory signals that enter the circulation. The body responds by upregulating the lipocalin 2 production, mainly in the bone marrow. The neutrophils in the bone marrow will then produce and secrete lipocalin 2 into circulation. Lipocalin 2 crosses the blood-brain barrier and reaches the paraventricular and ventromedial nucleus of the hypothalamus, where it binds to the melanocortin 4 receptor. This binding activates the melanocortin 4 receptor dependent anaerogenic pathway, inducing satiety and decreasing food intake. This is why you're also experiencing loss of weight and muscle mass. The critical role of lipocalin 2 during inflammation makes the potential target molecule for diagnosis or treatment of many inflammatory diseases and cancers. So, what happens if we interfere with this pathway? Different mice studies showed promising results in reversing the behavioral and physiological symptoms of cachexia. By knocking out lipocalin 2, the melanocortin 4 receptor, or by using an antagonist for this receptor, the decrease in appetite and body weight in cancer cachexia can be reversed. However, all this evidence comes from studies in mice. Therefore, future research in humans has to be done before we can determine whether treatments targeting these pathways could really be used in treating cancer cachexia. In addition, the roles of different molecular forms of lipocalin 2 in inflammation are unclear yet. Moreover, future research should focus on the combinations of nutritional and pharmacological therapies in combating excess lipocalin 2. So, let's come back to you, Hank. Did you understand?
Yes, so my cancer induced cachexia is a debilitating and life threatening syndrome characterized by loss of lean body mass. Lipocalin 2 is mainly produced by my bone marrow as a reaction to the tumor derived inflammatory cytokines, and it can reduce my appetite when binding to the melanocortin 4 receptor in the hypothalamus. Therapeutical strategies targeting lipocalin 2 or its receptor could reverse my cachectic symptoms.
Exactly. Although it seems to be a promising treatment, more research is still needed, and especially in humans.